with Halloween just around the corner, lots of people will be transforming themselves into ghouls and goblins and all kinds of scary creatures. Some may go as far as face paint and even contact lenses to achieve some horrific look. However, there are some health risks and precautions you should be taking when it comes to novelty contact lenses. And joining me now to talk about this is Dr. Christina Weng. Dr. Weng is an assistant professor of ophthalmology at the Baylor College of Medicine. Dr. Weng, welcome to the show, ma'am.
Thank you so much for having me.
Yes, ma'am. Okay, I'm going to show my age a little bit here. When I was a kid, Halloween costumes were throwing a sheet over your head and cutting out two eyes. So what exactly are novelty contact lenses and how do they work?
Well, we're beyond the age of bed sheets, I tell you that, and the costumes are more elaborate than ever. And to top off the costume look, more and more people are using novelty contact lenses, which are essentially a type of soft contact lens that people wear for either a theatrical or a cosmetic effect. And the difference from medical contact lenses is that the quality of the material is not of medical grade. It's much poorer in general. And also, they're of the same size and caliber. They're not measured or individualized for a certain person. And that contributes to some of the risks involved.
So these contact lenses, they create some kind of spooky color on the eyes? Or, I mean, why would somebody want to use them?
Absolutely. So you can pretty much get anything you're looking for these days. Most people use them to change the color of their eyes, and popular colors we see for Halloween are red eyes or black eyes. You can achieve that look. You can even get a theatrical effect where your eyes look like a cat. They're shaped differently. You can make your eyes purple. You can make your eyes glittery. And actually in Asia, some people actually wear these year-round to achieve the look of a larger eye. So there's many different looks that can be achieved with these novelty lenses.
Well, that kind of explains why they're so popular.
Yeah, absolutely.
Okay. Now, you have been quoted in a Baylor press release as saying, quote, "A lot of people think it's not a big deal because they are only going to wear them for one night. But this could not be further from the truth. And the truth is you can get some health issues that can haunt you long after October 31st. Dr. Weng, what kind of health issues, including infectious disease risk, are associated with these lenses?"
Well, the most common is probably something called a corneal abrasion or a scratch in the eye. And as I mentioned earlier, these lenses are not customized the way medical grade contact lenses are. So they're not designed for you as an individual, and all of us have slightly different shaped eyes. So by the lens not fitting properly, it slides sometimes in an obtrusive way over the eye, and it can cause a scratch in the very front surface of the eyeball, causing severe pain and also causing potentially loss of vision. Now, that is a very painful condition, but not as serious as another common side effect that can occur as a result of these novel contact lenses called a corneal ulcer. Corneal ulcer is a type of infection that is usually bacterial, but sometimes can be caused from fungus as well. And that is a very serious condition that can occur even after wearing lenses for just one time. And if somehow you get a small bit of bacteria on that contact lens and you place it on your eye for 2 hours or longer on a Halloween night, you can end up with something called corneal ulcer or corneal melting, where the whole eye can rapidly decline to the point where you actually lose your vision permanently.
Oh my gosh.
Very scary.
Right. Because we're talking about contact lenses, is the parasite acanthamoeba an issue with this?
It sure is, and I'm glad you asked about that. Acanthamoeba is, in the real world, it's relatively rare compared to the bacterias and other fungus infections that we see. But in the eye, for whatever reason, acanthamoeba has a very ripe breeding ground, and it often is found in people who wear contact lenses improperly. And unfortunately, with acanthamoeba, by the time it's diagnosed, it's often too late. And I hate to tell scary stories, but in the name of Halloween, one of the saddest stories I've seen was actually a few Halloweens ago where we see a spike in the use of novelty contact lenses. I had a patient who had a corneal ulcer develop as a result of wearing these purple contact lenses that she bought from a flea market. She wore them just for Halloween night and took them out as soon as she got home. But by the time she came to me a few days later with pain, it was too late, and we ended up having to actually remove her entire eye. Okay. So very serious things, although not all that common, they're also not that uncommon once you talk to some eye doctors.
Yeah. Well, now if someone insists on wearing novelty lenses for their costume this year, what advice do you have for them?
Sure. Well, I'll be honest with you, as an ophthalmologist, I would myself never wear novelty contact lenses. I think there's so much of a risk involved that I wouldn't. But if you must, I think the safest way to go about it is under the guidance of an eye care provider. And what you should do is visit with enough time prior to Halloween, visit with an eye care provider so that you can be measured precisely for a perfect fit of those contact lenses. And then you can take the prescription to a reliable and trustworthy source to obtain FDA-approved novelty contact lenses. I think that's the safest way. And then, of course, respecting the contact lens hygiene precautions, washing your hands, making sure you remove them as soon as you get home, wearing them for the shortest amount of time possible. All of those things will help you have a safe and healthy experience with the lenses. So
the novelty lenses do come in medical grade.
Yes, there are some that are FDA approved and of higher quality. So those are the ones that you're going to want to veer towards if you're going to wear them. And your optometrist or ophthalmologist will usually have recommendations for sources for where you can obtain those.
Sure. Okay. Well, you've already went over some safety tips, but I'm going to close with this. If you have any other safety tips for the audience for handling contact lenses in general.
Absolutely. I'm very passionate actually about spreading public health awareness about this, because even though we see a spike in novelty lenses during Halloween each year, actually we see contact lens problems year round. And so this really holds for all contact lens wearers. Number one, you want to wash your hands thoroughly before handling contact lenses. Number two, the solutions that you keep your contact lenses in should never be reused. And in between, when you're actually wearing your contact lenses, you should wash your contact lens case and let it air dry. The third is always a tip I remember from my own optometrist who told me that contact lenses should be like shoes, meaning that they're the last thing to go on as you leave the house and the first thing to be removed as soon as you come home. And this will really minimize the time you're actually wearing them, which is very important. The fourth is never, ever fall asleep with contact lenses, whether they're medical grade or not, and never forget to remove them as soon as you get home and are getting ready for bed. And the last one is, of course, don't ignore any symptoms that you're having. So let's say you do all these things properly, but you still end up with some pain in your eye or redness in your eye or discharge. Don't ignore it. Go see an eye doctor, remove your contact lenses, and go see them immediately, because infections can progress significantly within even just 12 hours.
Sure. Well, some great advice. I hope people are paying attention. And I want to thank you, Dr. Christina Weng, for your time and expertise, ma'am. I appreciate it.
Absolutely. Thank you. And thank you for having me.
You bet.